So how would somebody know if they were a candidate for a total shoulder or a knee?
That's a good question. They probably need to see me. No, I mean, really, it's hard to really say, well, do I have bad arthritis in my shoulder? I mean, shoulder replacements, there's two basic types, and, they're indicated for different reasons. But if for some reason somebody over the years is losing motion in their shoulder and they're stiffening up and they're feeling a crunching or grinding or clicking or, almost a ratcheting in their shoulder, they're most likely going to be somebody who has bad arthritis in their shoulder, who then may be a good candidate for a replacement. Somebody who's had a lot of rotator cuff surgery, for example, that have had failures, or they've become what we call pseudoparalytic and they can't lift their arm up at all because they're just so weak, that's more probably your candidate looking at a reverse shoulder. However, there are scenarios where we use a reverse shoulder for that arthritic patient that we talked about first. And so there's a lot of different ways to apply those implants. So it really would just be, kind of a steady decline. Oftentimes a history of shoulder surgery, sometimes not, especially in the primary arthritic shoulder. But it's just a little bit different pain patterns and something that kind of, we can work through. X-rays do shed a lot of light on that as well.
And as far as like recovery wise, I know you mentioned in both of those surgeries, most of them are for patients that don't have their full range of motion. So after total shoulder, can they expect to get their full motion back?
I would tell you they can expect to get the vast majority of it. It really just depends on how bad off they are to start. Both of those implants, for example, total shoulders in general, if you look at the history in the literature, they generally get a little bit better range of motion than reverses on average. So a reverse shoulder implant, you may expect, to get your forward elevation back up to 110 to 140. I will say anecdotally that a lot of people do get better than that. A reverse shoulder replacement is more constrained. It's designed to be more constrained. So there are some limitations in rotation, reaching down to your side or behind your back, that you tend not to see as much with a total shoulder. However, a total shoulder relies on a full intact rotator cuff, which the reverse doesn't always have to have. So the total shoulder is designed to act more like a normal shoulder, just you're resurfacing and taking out the arthritis. So in theory, yes, the total shoulder should get slightly more motion. It should act a little more like a normal shoulder, but it's really kind of done, you want to do it in the right circumstances, because if you have a really debilitated patient who already has a lot of preoperative weakness, even if they have bad arthritis, they may not respond very well to a total shoulder, because it does require a lot of rotator cuff rehab and getting yourself strong and using it again, whereas the reverse tends to be a little more forgiving.
Got it. And just with a plain rotator cuff patient, do most rotator cuff tears need surgery? Or is that just a general?
That's a good question. So it really depends on the size. It depends on a lot of other patient factors. I would say full thickness rotator cuff tears, as a general rule of thumb, do not heal. But that does not mean that all full thickness rotator cuff tears need surgery. There are a lot of patients with what we call a small tear, for example, which is less than a centimeter, that there is good evidence in the literature that physical therapy is very helpful in getting those patients back to a pain-free shoulder and a good functional shoulder. And in those patients, that we try to not do surgery if we don't have to. However, full thickness tears, about the flip of a coin, may progress, and if they do, those are the cases where you say, okay, well, you've tried some therapy, maybe surgery is indicated for you if you've kind of failed those measures. But you kind of have to think about it from that standpoint. Now, when somebody comes in and they say, well, I fell on my shoulder, I could lift it up yesterday, I can't lift it up today, those are the patients that, yes, they do need surgery.
Right.
So it's kind of the acute traumatic rotator cuff tear versus your patient who comes in with a degenerative rotator cuff tear where they were fine yesterday and they woke up this morning and they had some soreness in their shoulder and then they have a degenerative cuff tear. So a little bit different. But I would say that it really just depends on the scenario. But yeah, most, if not all, traumatic tears should have surgery. From the flip side of things, most tears are not traumatic. And in those cases, a lot at least should be trialed with therapy before proceeding with a surgery.